Hello, I'm Dr. Stephen Anderson. I'm a family physician and I have a background in electrical engineering software development, including C#, .NET, as well as Oracle databases. And I'd like to comment on something that always has to remain heart and soul of medicine, and that is taking good care of patients. But something that I believe is part and parcel to that is just in designing the systems to be suitable to the people that need to use them, namely the clinical staff. The slogan that I used to love at the company that I was at previous was clinical productivity by design. And it was a really neat company because that's really what we were focused on, was helping the providers be productive clinically by our very design processes. And I think with this kind of a focus, clinical medicine really can be revitalized in the eyes of the providers and staff that need to use the electronic medical records. Now I'll demonstrate logging into the electronic medical record system as well as signing up for a patient. Me and the other clinical staff do hundreds of analogous sign-ins during a typical workday. As I'm getting logged in there, let's take a step back and think about what it is that I'm accomplishing with the amount of effort that I'm going through there. Basically what I've done is authenticated myself as a user of the electronic medical record and signed up for a patient, but it seems that the cost really does outweigh what's actually being done. The step of authenticating could go much quicker, say with a biometric device, and really the system will already know that that particular patient is in the room that I've just signed in on, and could make a very valid assumption 90+% of the time that I'll be the provider doing the clinical documentation for the visit. Let's put some numbers together to look at the cost of that 15 to 20 second login procedure. To make the math easy, we'll assume a period of $100 an hour. And now if we assume conservatively that we'll log in 50 times a day, that gives us $25 a day per provider we spend just on logging in. Let's further assume that there's 5,000 clinical providers in our health system of 26,000 that also need to log in 50 times a day. This gives us a total of $125,000 per day that we spend just on logging in our health system alone. So just to recap briefly, I'm Dr. Stephen Anderson. I have a background in electrical engineering as well as software and database development. And just pointed out a brief example of one area where I think we could make medicine more efficient and more fun to practice. So again, thanks so much for watching, and have a great night.